Colon cancer is one of the leading causes of cancer death in this country. Kind of flip-flops between number 2 or number 3 from time to time. But I tell my patients a lot that colon cancer is one of those types of cancers that affects people who are otherwise behaving themselves. Because that leading cause of cancer, lung cancer, frequently is associated with smoking. Colon cancer, there's not always a trigger for it. There's a genetic link, there are some dietary links, but in reality, most people are behaving themselves until suddenly there's a problem. We know after age 50, again now 45 perhaps, that the incidence begins to go up of colon cancer. So we want to start screening before people develop the disease. We know that that cancer comes from a polyp, so if we can identify the polyp on a procedure such as a colonoscopy, removing it, identifying it and then removing it is not only detecting but preventing that cancer from ever really setting foot in the body. Risk factors for colon cancer, obviously age is what everybody thinks of. You hit 50 and it's time to go get some type of screening. There's actually new guidance that it should be younger than that. American Cancer Society is talking about age 45 and beyond. If there's family history, first degree relative like mom, dad, brother, sister, or multiple relatives, grandparents, aunts, uncles, any symptoms, bleeding, unexplained weight loss, belly pain, those are all reasons to think about seeking medical care, maybe getting screened sooner as well. So the best screening without a doubt is colonoscopy. You're going to get in, you're going to get screened, and if it's clean and clear, it is kind of the most involved but least often test. It's a busy day, but it's only once every 10 years. There's other ways to get screened that are less invasive, a little bit easier to get done and maybe get scheduled, but they need to be done more frequently. So there's a stool DNA test called Cologuard. That's as easy as using the restroom at home yourself and then sending the test off. And if it's negative, it's very predictive that everything's okay. If it's abnormal or positive, you need to still go get a colonoscopy to see what else is going on. And if it is negative, it's only clearing you for about 3 years at a time. So that would need to be done 3 times over to 1 colonoscopy. There are still the old check in the office test too for blood in the stool. That's only good a year at a time and still minimally invasive, although there's no special prep for it. And then there are some shorter scopes such as a sigmoidoscopy, which can still be done, but in reality, if you have access to full colonoscopy, that's what you should probably be asking for. We consider it the gold standard. Prep is everybody's least favorite part. It's the part they remember the most. Usually when I see them on the day of the procedure, I've told them the worst is over. That was yesterday because they had to endure that prep. But a couple of things can help. An all liquid diet for a couple of days in advance can be really beneficial. Milkshakes, soups, applesauce, pudding in regards to kind of maintaining being hydrated and adequate nutrition. So you can definitely do a liquid diet to help the prep. You can make sure you start further ahead than just the morning of, and follow your doctor's instructions. There's some medications you want to avoid, such as aspirin. There's some certain color foods you want to avoid. Red dye looks red on the inside as well. So if you're drinking red Kool-Aid, you might fool your doctor into thinking there's bleeding coming from somewhere. So there are some specific instructions. But doing the liquid diet ahead of time can help some folks tolerate that prep. Getting the entire prep in, doing it per the prescribed instructions, enables us to see what we need to see and not have to see you back for 10 years. Because I have had patients where they've had to come back, I couldn't see everything I needed, we're going to have you back in a month or in 3 months or a year. And you really don't want to do this test any more often than you need to. So generally they'll take their prep the day before. They wake up the morning of, they go into the center, whether it's a hospital setting, an ambulatory surgery center, or there are even some office-based endoscopy suites. Then usually you meet with the staff to get changed, get into the gown, the bed, get comfortable, get prepared. Then usually get an IV started, get the medication that makes the procedure much more tolerable. The procedure is then performed, and frequently I like to talk to the patient ahead of the procedure and then afterwards, kind of give them that post-game summary. This is what we found, this is what I want you to do next, this is when we'll see you again. Especially if we had to do biopsies or maybe they were in for something other than colon cancer screening, chronic abdominal pain or weight loss. Maybe we find infection or some other cause and we need to have some time to be able to explain that. So they always should have a family member or a friend or a trusted adult driver with them. They don't have to be a part of the conversation, but we can't have you drive yourself home having been sedated. It's kind of that magic 4 to 6 hour window we tell folks. We don't want you climbing on the roof. We don't want you operating power tools. The next day, it's usually back to business as usual, no restrictions. So a lot of folks like to schedule it on a Monday or a Friday, maybe get a longer weekend, or a Tuesday or a Thursday and take the day before, the day after off, so they can also, again, get a little stretch off. Just because you have a polyp doesn't mean you have a cancer. Matter of fact, approximately 2/3 or more of polyps will not have a cancer risk or potential. So the odds are in your favor that if you have a polyp, it's not a cancer. But because there's a time arc for that polyp to grow into a cancer, detecting it early and removing it through a process like colonoscopy is so much easier than waiting until it's established, perhaps spread, and now our choices for treatment are much more limited, much more severe and significant, and the health impact is much more critical.